Well, the Langya virus is a Nipah virus, and it is related to the Hendra and Nipah virus, where we see outbreaks happening in Bangladesh. So it can cause respiratory symptoms, fever, cough, and fatigue. However, there have only been about 35 cases identified so far, and that's over a 2-year period. So while we do classify it as a new virus because of the zoonotic spillover from animal to human, so right now we don't think that there is any human-to-human transmission, but ongoing surveillance is critical to determine that. It looks as though the current investigation shows that actually this isn't very fatal or severe in any of the cases found so far. There are, in some cases, complications that can arise, but the good news is that it's been mild in all the cases identified.
Where was it first identified and how has it spread to humans?
So it was identified in eastern China. So we're looking at the Shandong province and then also spread to Henan. And it is believed that it has been the primary reservoir, could be a shrew. So it's within an animal. Many other animals were tested, and this is the best evidence available so far because the highest number of virus was identified in this particular shrew mole. So again, that zoonotic spillover is happening frequently, and it's just that they're not always picked up or identified. Because of some of the COVID efforts, we do see that surveillance efforts have increased, particularly throughout China. So now when patients present in hospital with fever, et cetera, there are more extensive tests that are carried out to identify what those viruses are. So as a result, we're getting better information about the frequency of these spillovers, and early detection is really important, but that doesn't mean that every time we find a new virus spillover event, that it is a pandemic level problem.
So how concerned should we be about the Langya virus?
Well, certainly ongoing surveillance and being vigilant is important, but there is no need to panic. As mentioned earlier, many of the symptoms are actually not that severe. And given that this has been over a 2-year period, there has been some sensationalist reporting around this topic, but this wasn't just found yesterday. And the case numbers themselves, it doesn't provide evidence that doesn't spread as easily as, for instance, coronaviruses.
Well, can any other comparisons be made to COVID-19 at all?
Again, the zoonotic spillover, one of the reasons that it's important for it to be closely monitored is because there are some unpredictable variables and factors that can come into play that surprise us when we have a newly identified virus spreading from the animal population into humans. So again, that is the leading hypothesis for how COVID-19 has caused the pandemic, one of 4 hypotheses provided by the WHO. But in this instance, again, it just shows how important it is that we maintain these surveillance programs, but B, from a broader perspective, also ensure that our policies, the growing urbanization, the deforestation efforts that we have, all of these factors do change the ecosystem, and as a result, allow for more disease and illnesses to affect humans. So we also have to think about this in our policy making, and COVID-19 has been a perfect example of how that happens.
How do humans pick up this virus?
So there's more research going on about this. We don't have a full picture exactly of how this occurs, and even now, none of the cases appear to be linked. But it does appear that there could even be an intermediary animal in which the infection is then spread to humans through close contact. So again, more information and more evidence is needed to be done to fully understand this picture, and we'll have a better idea of this mode of transmission in coming weeks.
Meanwhile, Oksana, there's been a booster vaccination campaign against polio for children under 10 in London. How has polio re-emerged in places like London and New York recently?
Well, polio is typically viewed, at least in the UK, North America, as a disease of the past. The whole of Europe was declared as polio-free in 2003. So now what we're seeing, and it's a bit more of a complicated picture, is that in many countries where we see higher circulation of polio, including Afghanistan and Pakistan, in these regions and in other countries where polio is circulating, they do use a live form of the vaccine, so the live oral vaccine. Whereas in the UK, most developed countries, we are using a inactivated a vaccine for polio, and many people already have existing protection. However, in communities, especially coming out of the pandemic, many children have missed out on routine immunizations, and that is much, much worse in low-income and low and middle-income countries. So when we see, as a result of movement of people, etc., who have the live version of the vaccine, and then they are more susceptible to spreading it in pockets where vaccination levels are lower. So as a result, you can see that there's some mutations occurring. And that's why there has been, the UK Health Security Agency has actually recommended that booster shots or first doses are given for all children aged 1 to 9 in the UK, specifically because there's this potential for a relatively safe form of the live oral vaccine mutating into a form that can cause harm in pockets of unvaccinated people, and as a result, leading to perhaps a new version that can cause paralysis. So this is all preempting cases. So in the UK, there have been no detected cases or paralysis, but in the US, there has been a paralytic case, which means that actually there are probably many thousands of cases that have not yet been detected, which means that this why these programs, the vaccination programs in general, are so important to keep up to date, because we can slide right back into history more easily than people think.
Oksana Pyzik, thanks for sharing your knowledge with us. Really appreciate it.
Thank you.